Good afternoon. We are Group 1 and our program is all about First Feed, a breastfeeding program that is intended to help women breastfeed past 6 months and up to 12 months. Our group members include Alice, Maritza, Krista, Jamie, Carmen, and Laura. The objectives for our study is after 6 months, the participants will be able to recite 3 health benefits that are beneficial to both mom and baby. And also at the end of our intervention, we hope to see at least 65% of women within our experimental group breastfeeding past 6 months. The goal of our study is to increase overall rates of breastfeeding past 6 months and up to 12 months. And the general purpose is to improve the health of both mom and baby. The population we'll be using for the study is pregnant women ages 18 to 55 who seek and receive care from Sharp and Scripps healthcare systems. Some of our evaluation questions include, did the intervention have an impact on breastfeeding past 6 months? Also, does age affect breastfeeding past 6 months? And does a mother's marital status, which we saw was a support system, affect her likelihood of breastfeeding? The conceptual model that we use for our program is the health belief model. And also our educational plan will encourage moms to breastfeed for longer durations. In addition to this, we use social marketing networks that will help a mother not only improve her self-efficacy, but provide a network for her to improve her breastfeeding to our benchmark and hopefully pass. The outcomes or major outcomes for our study is to improve the overall benefits for both mother and the baby and have less doctor's visits that are a result of health issues. Our research design is a quasi-experimental, and the 2 hospitals that we will use is Sharp Chula Vista Medical Center as well as Scripps Mercy Hospital Chula Vista. And participants of the study will be assigned to these hospitals based on their residence.
The methods we used in our study were convenient sampling and a survey. Our independent variables were age, residence, and marital status. Our dependent variables were the length of time that breastfeeding occurs. We used 3 types of data. Our categorical data is marital status and location. Our interval data is age, and our ratio data is the number of months breastfeeding. To analyze our results, we used the survey to evaluate the intervention results and the breastfeeding knowledge. We used a t-test to determine the influence of age, and we had 3 major findings. In the study, women were assigned to control or experimental groups based on their proximity to the 2 hospitals. Our results indicate that women in the experimental group generally breastfed longer than those in the control group, proving that our intervention was a success. Additionally, the group we found to breastfeed the longest were those in the experimental group who had a significant other, showing that a social support is a factor in the likelihood of breastfeeding. This is the data we used for our t-test to evaluate age. Based on our results, we accepted our null hypothesis that age did not influence the length of time breastfeeding. The major limitations of our evaluation was that most of our data is self-reported. This creates a problem because self-reported data is not always accurate or reliable. For our conclusion, our objective was to have 65% of women in our experimental group breastfeed past 6 months. However, our findings indicate our intervention caused nearly 80% of women to breastfeed past 6 months, which exceeded our expectations. And finally, our learning objective was supported by our findings that showed women in the experimental group obtained a higher level of knowledge compared to women in the control group. Thank you.